Before entering any room to perform any treatment or any activity, an employee must knock on the door, should pause, not enter directly upon knocking, wait long enough for a response, then knock again if you don't hear a response, then enter the room and introduce yourself and explain what you will be doing. When the individual comes in to provide Care and they're greeting the resident, it's important, if there's a surveyor or an instructor present or someone else that's going to be assisting, that the person asks permission to have that person in the room. In this case, we're going to say it's a surveyor.
Mrs. Smith, I have a surveyor with me today. Is it okay if she observes my making you fresher and changing your brief?
So what she's done is exactly perfect. She's asked the residents permission to have another individual in the room with her. And in this case, it was a surveyor. This resident was unable to reply, being that Ms. Smith is non-responsive. When washing your hands before any procedure, you want to make sure that you wash your hands for a minimum of 20 seconds. That's the time it takes to sing Happy Birthday twice slowly. Make sure that you wash all the way up to your wrists, cleaning underneath your fingernails, in between your fingers with good friction. Remember, 20 seconds. When you're rinsing your hands, always rinsing so that the dirty end is rinsing from the top down. Don't put your hands right side up. When beginning to dry your hands, take a clean towel, dry your hands, and remembering that when you turn off the faucet, you'll use a different towel to turn off the faucets with. Remembering when you turn off the faucets to use a clean towel, not the one you wiped your hands with. After we knock on the door, enter the room, and we're preparing our supplies, you may have seen in a previous edition of our video that the items were laying directly on the bed. After multiple surveys and different surveyors' approach to this issue, we recognize that some surveyors want to see a barrier between the supplies. You'll see on this bedside table we've used a towel where the gloves have been removed and the swipes and everything has been laid on a towel to prevent any contamination. This also can be done with a garbage bag. It can be laid on the bed as well as a bedside table. What you must remember is if you're using the bedside table, you must remove all items such as water pitchers, cups, and when you finish, you must clean the top of the table. Having had all the supplies assembled before she was going to begin is always a help, is to have everything ready so that you don't have to leave the room. You don't have to stop what you're doing. So what you're going to need are enough pairs of gloves to make sure that you can change when you're moving from clean to dirty. You want to make sure that you have ample swipes so that you can use one swipe for every wipe that you do. You can see that the nurse or the CNA now is putting on their gloves and letting the resident know at all times what they're doing.
Okay, now I'm going to pull the cover back.
Maintaining the dignity of the resident is always important to let them know what you're doing at all times.
Okay, and now I'm going to move your legs so it's a little bit easier on you.
Every movement for the resident, if they can help you, you ask them to help you. If they can't, you still explain to them what you're going to be doing. And now you can watch removing enough of the wipes that you're not going to have to go back to the container while you're performing the procedure.
So now I've got everything ready. I'm going to go ahead and take your brief off.
So the CNA has explained, or the nurse has explained, that they're removing the brief. And everything that's done is done very gently. There's no need for rushing. That's how skin tears, bruising happens. So we just think about this as being very gentle, recognizing that for a resident who's alert and oriented, this can be very concerning to them. They want to know what's going on. Dignity is important. The first thing we want to do is make sure that we completely spread the labia apart so that we can get a good wipe from the very top to the bottom, always moving from top to bottom, from clean to dirty. That's towards the anus. There's one swipe down the middle, still holding the labia apart, cleaning on the inside of one labia, one wipe, one swipe. Again, on the other side, inside of the labia. So we've had 3 wipes so far, one down the middle, one each side on the internal. Now we'll take a clean wipe and wipe on the outside of the labia. Throw that away. New wipe on the other side of the labia. And throw that away. We're now going to wipe across the mons pubis. And we also will wipe all the way up to where the top of the brief touches the abdomen. That can be as high as the umbilicus or even higher. All right. Now we're going to clean over the inside of the thigh. Going to clean the inside of the thigh again. This is all wiping where the brief was. Cleaning on the outside. Making sure that we get around that hip as much as we possibly can. Now moving to the other side, completely wiping around that hip. Gently and advising the resident, I'm now going to roll you over.
Roll you over, and if you can hold on.
Advising the resident that you are going to wipe them now from the bottom. You start from the anus and work upwards. Note that she's exerting very little pressure but still maintaining the stability of the resident, holding on to the hip or the shoulder but with no pressure to cause bruising or any type of tearing as she moves. Make one wipe, one swipe again. Now going to cover one complete area of the buttocks. The other buttocks will be wiped. One wipe, one swipe. We can't reinforce that enough. Cleaning the outer hip, any area of which is covered by the brief or any area that you can see that needs cleaning. Gently rolling the brief up. Notice there was no pulling that out from underneath the resident. Pulling can cause shearing, tear the skin. She has gently held on to the resident and has affirmed that the resident is safe and secure on the bed, that she will not roll off. Removes her gloves because she is now completing what we would consider the dirty aspect of the care. That means the contaminated part. Now we're moving to what we consider the clean aspect of the care. So we're donning clean gloves before we apply the clean brief. Everything that we're doing with a gentle motion. There is no rushing because that is what causes skin tears and injury to the resident. Okay. And it's also scary. She's telling the resident
you're back over.
She's going to roll her back over, and she's gently applying the brief.
Connect these side tabs so it'll stay in place.
She's going to ask the resident, is this comfortable? Is this too tight or too loose? If the resident can respond, she'll act accordingly. Notice now everything that she's touching is clean. It's a clean brief. The resident has been cleaned, and always maintaining the resident's dignity, getting the resident recovered and comfortable. Making sure the resident is positioned appropriately if the resident requires positioning. She'll remember to place the call bell right next to the resident. Recall yourself that even if the resident is comatose or unable to respond, there must be a call bell next to the resident, every resident at all times. Now, the nurse or CNA will remove the gloves, place them in the garbage, take the outside edge of the bag, wrapping the bag around the dirty contents. This will be discarded, and the employee will always wash her hands or his hands after removing gloves. So we wash our hands before and after gloves. Every resident care situation is unique. You just watched a resident have complete peri-care. In this case, this resident will need to have a barrier cream applied. I want you to also understand that you can have an assistant with you when we do resident care. In this case, I'm assisting the resident, gently holding her so that she does not roll off the bed. And the assistant here is applying barrier cream. I want you to note that she has clean gloves on when she's doing this. And also, as she needs more barrier cream, she would not touch her glove with the tube in any way, but keeps far enough distance away so that she does not contaminate the tube with the hand that has already touched the resident. Always touching the tube with the clean gloved hand, and then removing the barrier cream glove that she used, applying a new glove before she continues with the remainder of the peri-care. And I'm gently assisting with the care for this resident. Peri-care with a resident that has a Foley catheter is done almost identically to that of a resident that does not have a Foley. So what we're going to see is that you need to hold on to the catheter as close to the resident as you can, and so that there's no pulling or tugging. Gently use one of the wipes and wipe away about 3 to 5 inches at the tip of the Foley to make sure that we have cleaned that as well. Always making sure that you reattach the Foley if it has come away from the leg band. All Foley catheters must be attached to a leg band. When we deal with the incontinence care of a male individual, we want to highlight for you some of the most important things that you need to remember. The first thing is that you want to take a clean wipe and wipe off the scrotal sac, lifting up the penis gently off of the scrotum, throwing away, again, one wipe, one swipe. You're going to do the head of the penis and with a cleansing wipe, throwing away that wipe, taking another one, and while you hold the head of the penis, you're going to do a circular motion around the shaft. It's very difficult on a mannequin to see this, and if you can hold the head of the penis and do a twisting motion with the wipe, we'll let you take a look at that one more time. One more time, we'll show you holding the head of the penis, making sure that you've gone all the way around the shaft of the penis in a circular motion. Then you want to continue on just the same as you would if you were now cleaning a female. And the same thing with the back, that you want to make sure that you're wiping from the anus up, not back down. Brief review of what we've done today with some of the important points that you must remember. Number one was to knock on the door before entering and waiting long enough for someone to respond, taking time if they don't respond to knock again before you enter and enter slowly. Always introducing yourself to the resident and advising them of what you are in the room to do. Asking them permission to do that, and if you have another individual with you, making sure that they give their permission as well. If it's a surveyor, a student, or another employee, that they are giving their permission for them to assist. Gathering all your supplies together before you begin. Washing your hands thoroughly before you start the procedure. Explaining the procedure thoroughly to the resident as you are performing it. At the end of the procedure, you need to make sure when you remove your gloves that you wash your hands. If you're providing care to someone that has a Foley catheter, you want to make sure that you always maintain it right as close as you can to the meatus. Hold on that catheter so there's no tugging, pulling, or pinching to the resident, wiping that down. Always returning the patient to a comfortable and dignified position. I think one of the things that when we work in these rooms we often forget is that you have to always pull curtains. Even if they're in a private room, someone can come through the door. We work in a training room and we don't always have those accessories, but you must remember in a room to always pull the curtain, provide privacy from another roommate or even from the door. before you begin the procedure. This concludes our Perineal Care training. We want you to note that this is our second version of filming Perineal Care, and we've added a few components, one of those being placing a barrier for where you put your supplies. So you will have noted that we put a towel or a garbage bag liner on a bedside table or on the bed, under the supplies. We've been unable to obtain a consistent guideline regarding this practice, but we do recommend this placement of a barrier between the supply items and the bedside table or the bed. We want you to especially note that you are required to change your gloves a minimum of 3 times during this procedure. Remember, you start with clean gloves. You're going to have clean gloves again before you turn the resident and begin on the back side of the resident, and clean gloves as you move from cleaning the resident to placing the new brief. So whenever you move from dirty to a clean area, you're going to be changing your gloves. You're free to change your gloves as often as you wish or you're needed, especially if you have a resident who's had a large bowel movement and will require more cleansing. So make sure that you feel comfortable doing that and always placing enough gloves to be able to do so. Remember to ask for an assistant if you need help or if you're nervous with a surveyor being present. There is no reason not to have somebody there to help you and guide you along and remind you of these practices. We hope that you will watch this video a number of times, feel comfortable, and if you have any questions, don't hesitate to contact your training coordinator. Thank you for joining us.